Dr. K.S. Satish is based out of Bangalore and has specialization in pulmonology and HIV medicine, which is an extraordinary combination of vital streams in medicine. He has an experience of more than 30 years, and throughout his practice, he has also served as a principal investigator to almost 15 clinical trials conducted at a global level. And now, he is one of the most important member of COVID-19 Task Force down south.
The coronavirus is the biggest threat this country has faced for decades, and this country is not alone.
Let's do our due diligence, take the precautions we need to take care of ourselves.
No matter what, I still love my job and I'm going to do everything in my power to save lives.
कल की बात पुरानी नए दौर में लिखेंगे मिलकर नई कहानी.
We are in the middle of a peak of a pandemic, unheard of, unknown to any one of us. I've been in practice for 34 years now, and being a pulmonologist and with a background of HIV. So I'm also a HIV physician, and I've been treating a lot of HIV patients. So that has helped me to understand this virus better. My first encounter was, this patient who came with a urinary tract infection, I think way back in March, and was admitted. And for some reason, there were hardly any COVID patients in Bangalore. And for some reason, something stuck to us that she was running high fever, but a urinary tract infection known to our hospital. So somehow we said, okay, let her go to the isolation room. She went to the isolation room. And then when we took some detailed history, there was this history of travel to Dubai. Those days, the travel history was so important. Yes. And then we tested and then came out positive. But fortunately, she was in isolation room. Fortunately, we were all, using the usual protective gears, not a PPE kit. And we treated her. And that was the first experience. She had problems and slowly she recovered and gave us an opportunity to learn, to prepare ourselves for this pandemic. And that experience gave us a lot of confidence. She went home, after 2 weeks of stay in the hospital, and which was great. And she did very well, and slowly she recovered. And even the family put it up in their Facebooks in the name and everything, which was good because the stigma was there that time, and that was all neutralized. I'm very happy that patient went home, and then we all learned. And then those who got, exposed inadvertently were all tested. Fortunately, everyone came negative, and that helped us to prepare ourselves for the patients that we have now. We have something like 74 patients at Vikram Hospital. So that was our first encounter. Happy ending, very good, and very happy, all of us. As the numbers increase, exponentially, as you rightly mentioned, the number of, complications and number of deaths also will increase. This is universal all over the world. Even though, the recovery is good in India, thanks to largely, younger, population, and probably, I would say testing and tracking and tracing, which has happened in the last, few months, which is amazing, going and tracking and tracing these contacts, which has helped us to definitely contain, to a large extent. So that's what has happened, which is a good sign that we have kept the case fatality rate low. I'm not saying those who have died, even if there is one patient dying, for that family it is 100%, which is not good. Yes. But this is a pandemic which takes care, or which kills people who are at high risk and elderly people, unfortunately. In Bangalore and in Karnataka as well, and it is reflecting same as the national figure. the case fatality is less than 5. We are about 3 or something, and recovery also is quite good, even in our hospital, you know. And when we have a patient dying, we all worry about it. I'm also in the COVID expert committee, and putting up guidelines, home isolation, and also about the mortality. We have analyzed about nearly 100 patients in Karnataka, all over Karnataka, the committee including me, and we have found very few people who are younger than 50, dying with COVID disease. And those who have died, even in that younger group, there were some pre-existing diseases, and which made them vulnerable. But here and there, for no reason, some young people without any comorbidity and pre-existing disease have succumbed to this disease, and which is well known all over the world. But more and more, what we are seeing now is patients who are elderly, patients who have comorbidity, uncontrolled diabetes, uncontrolled hypertension, ischemic heart disease, those who are immunocompromised, and those who are on dialysis, and these kind of patients only we are seeing, who have a high mortality. Even in this, I had recently 88-year-old, gentleman going home with pneumonia. He's gone home and treated and doing very well, very positive person. And I keep seeing in the paper somebody in Kerala who's 105 years old is also doing well. So these are all good things. Even for elderly people, they should not think that just because of their age or just because of their comorbidity, they are going to, face complication, risk, and death. So they should be positive. That's what I feel. In this pandemic, one should have that positive vibe, positive attitude, positive energy. Everyone, from the healthcare workers to politicians to bureaucrats, and when you have positive energy, positive attitude, everything will turn out to be positive. We should never put our heads down during a pandemic. We should, put our heads up and walk around doing everything honestly and sincerely and properly and scientifically. The number of tests have increased, and the rapid test has helped us to quickly not to forget about non-COVID patients. They should not suffer for their no fault of theirs, because they have, for example, heart attack, they have an acute asthma attack, or a pneumonia, which is non-COVID related, or a diabetic complication, or a dialysis. So they should also be equally be treated properly, like what we used to do before the pandemic. If you see the natural history of this virus, and if you see what happens during the first week, there is viral multiplication. There is rapid viral multiplication. Okay, and this is fought by our own immune system. That's why young people can manage. The immune system takes care of it. It has antiviral property. It kills the virus, controls the infection, because you have good immune system. With age, that immunity goes down. And with all these comorbids that I mentioned, you are vulnerable because your immune system is not, strong. Now, during this viral replication during the first week, that is when the antivirals will help. So about the HCQ story, you have ivermectin, you have doxycycline, you have azithromycin. These are all repurposed drugs, has shown to be some antiviral property. So this is where they work. Now, there are only two COVID antiviral drugs, SARS-CoV-2 antiviral drugs. Even though they are repurposed, they are useful. Like favipiravir is good in mild to moderate cases, and even the Indian data, which is presented just yesterday, is showing very promising and done very well. A good controlled study which is done and showing that patients recover with when you use them properly. Remdesivir, of course, is more reserved for moderate to severe. Again, here, what is important here, the timing of these medications are important. So you have to be on your toes to use these medications. And during the first week, when there is a viral replication, when there is virus, then these will work. The second phase or the second week is all inflammation, not infection. So inflammation is the body's response to the virus, the cytokine storm that you hear. That is because the immune system react in a hyperimmune kind of situation, tries to control this virus. In that battle between the virus and the immune system, secreting all these the biomarkers, what we call, and these cytokines, they damage the parts of the body, especially the lung. And that results in the second phase, which are more dangerous and complications of that, which is ARDS, damage to the lung, and those kind of things. That is where, the antivirals will not work. The anti-inflammatory agents will work, the steroids, for example, and the anti-IL-6, for example, those ventilator and those things to tide over the crisis. So it's very important that we use these drugs judiciously, properly, and timing is important. Here, the role of containing this infection or pandemic, this is our role, the public role, very important. Fortunately, in India, we have not had problems of patients and public coming out saying, I'm not going to use this mask. Fortunately, there has been, even though they may not have used it, but there is no big movement or anything like that which you hear from Western world. That is a good sign. So I always say, we already have a vaccine. I always, when I talk to the media, I say, we already have a vaccine. Why are you worried about the vaccines which are coming? What are these vaccines? Number one, wear mask, tight fitting mask all the time when you meet someone, and see that the other person also wears a mask. Almost 90% protection. Social distancing, more than 1 meter, another way of protection. Hand washing frequently. So when you touch surfaces and things like that, don't touch your, mouth, eyes and nose and all that. This gives 90 to 95% protection. Which vaccine in the world is going to give this protection? And it is, it is free, absolutely free, and it is all our attitude. And number 4, important is our attitude, which is important. So I may know about all this, but I may not do this. So which means my attitude is important to prevent infection in the community. So that is where we all must take responsibility, and that we are going to use this for how long? Doesn't matter how long. Don't ask this question about how long. Use it till the pandemic goes. When does the pandemic goes? Nobody knows about it. 6 months, 1 year, 2 years, it's going to stay. But be prepared. There is nothing wrong, using a mask and doing all this, which is very simple. So the young people, who are asymptomatic or mildly symptomatic, they also drive the herd immunity, but they also, infect elderly at home. They propagate this infection. That's why they have to wear the mask. And it may not be for them, at least for the sake of others at home and elderly people, the vulnerable people, that they should, do this, on a regular basis. For example, H1N1, which came in 2009, most of us have herd immunity against H1N1. So it took years and years to develop this herd immunity. So to develop that kind of a herd immunity, if you see already herd immunity developed in Wuhan and Spain and those countries, it's not great. Wuhan, they said about 2% to 4% only herd immunity, antibodies positive. We still don't know much about the herd immunity. Let's wait and see how many of us will develop this herd immunity, young people, because they are the ones who go out and work, and then they have to work. They cannot sit at home. So if they develop herd immunity, it's good for us. And herd immunity is something which is completely unique to each places. So it may be different in Italy, Spain, UK, to US and to India. So let's watch. There are a lot of the surveillance which is going on about the herd immunity testing by doing an antibody titer. And we were all as Indians, exposed to various, infection, lot of viral infections, and there may be some kind of a cross immunity. As you know, this coronavirus is not the first coronavirus in the world. There have been many coronaviruses in the past. Okay, for example, MERS, also is another coronavirus. So probably that exposure has led to some, immunity, innate immunity in all of us. And of course, India consists of a lot of young people, and that has helped India to, face this, issues with immunity. Yes, looks like Indians have good immunity because of the younger population and BCG vaccination and other vaccinations as well. My, message is always positive. Okay, yes, we are in the middle of a pandemic, but we have learned so much about the virus and the pandemic and the disease and the natural history. So there is nothing to be feared about it. Everyone keeps asking about there is no medicine. There is medicine. We just spoke about the antivirals, we spoke about the anti-inflammatory. There is medicine. So there is vaccine and there is prevention within our hands. Sometimes, these are not in our hands. It is there. And my message is, please, do these three important things all the time: mask, social distancing, hand sanitization, and your attitude towards it.
Dr. K.S. Satish is one of those brave doctors who has taken the command and leading the charge against this dreadful virus. Vaccine or not, he has saved countless number of people in the past 5 months and is continuing to do so even now. We salute him for his services.